Well, I think we'll move beyond where we are now when we feel like we've done as much as we can do to get the folks who are part of the communities that are currently eligible vaccinated. I mean, there are 430,000 people over the age of 75 in Massachusetts. We probably vaccinated somewhere in the 200,000 neighborhood the last 5 or 6 days. That's a big number, but I think we'll probably want to leave it open for a little while longer to see if some more 75-year-old folks sign up.
Governor, LG has talked about working with some companies, I think, going very early on in the distribution. When do you think that would start coming into play, like a Gillette or something like that? Not Gillette. Stadium.
Not Gillette the stadium, Gillette the company? Yeah. I would say that I think for us, you know, the important thing here is to get as many of the 75-year-olds who are eligible vaccinated as possible, as many of the PCAs and home health care workers vaccinated as possible, get as many of the folks who are in the categories, the folks with developmental disabilities and the people who take care of them, the folks with mental health issues and the people who take care of them, the folks who work in homeless shelters and the people they take care of. The federal program on the pharmacy piece is now moving into assisted living facilities and senior housing, really key areas where it's very important that we make sure we get those folks vaccinated and get them vaccinated early in the process. I would say that we'll move when we get to the point where we think we've done a pretty good job with the communities that are currently eligible, and then we'll move. But I want to make sure we give these communities, part of the reason these communities were early was because they're vulnerable and at risk, and especially with some of the older folks, we need to give them a little room here to get there.